Hi everyone, this is Dr. Scott Gray from scottgraypt.com, and so today we're going to go over a new topic of Manual Therapy Monday, and that is thoracic manipulation. And so we're talking about a grade 5 thrust that we use commonly in the clinic when patients try to lose that thoracic extension through their daily work habits. And so we're going to talk about this because a lot of times I see students and other clinicians, they're not doing the technique as effective as I would like to see. And so we're going to talk about 3 common errors that they make. And so the first being is patient positioning. So a lot of times we get the patient down, but we're not in a great position. The second thing is we're not increasing tension and locking out the segments above, so we're not going to get an effective mobilization of the thoracic spine. And the third thing is getting our weight all the way over the top of the person. And that's what we're going to talk about here today. So Sydney, if you can, go ahead and lay on your back for me. And so this is what usually I see a lot of students do, is they don't have the patient in a comfortable position. So you want to make sure that their head is supported, they can have their feet bent to help support the low back, and then, so that's a good position for them. The second thing is I want to make sure that I have them in a V method, or if you like to do the hands behind the head, and like this method you can also do to help support the patient. Either way you do it, you just want to make sure that they're really supported. The third thing is you want to make sure once we kind of get the patient in the position that we want to get our body weight all the way over the top of them. A lot of times I see clinicians, they kind of only come to here and then they don't get the effect that they're after. So we're going to apply it here with Sydney, and I'll show you how I do it. But before we do it, I want to look at what segments we need to thrust, and then we'll reassess. So Sydney, go ahead, stand on up. So we're just going to look at Sydney here. So we're just looking at all the good things about her, but we're also seeing that she's a student and she's working really hard to get those grades to get into PT school. So we're going to take a look at, see if we can help that out. So Sydney, go ahead and let's actually turn this way for video land, and lift your hands straight up overhead and far back as you can, and not terrible per se, and go ahead back up, and then again one more. And so she's maybe not getting enough, a little bit right up in here. So we're going to go ahead and have Sydney go ahead and lay on her back, and then slide down this way a little bit for me. So again, I'm just going to get her in a good patient position. She's nice and relaxed. And then from here, I'm going to make her nice and snug. And so from here, I can also make my pistol grip. And I can also either hold her hands here to get my thrust, or I can hold her head here. Either way works. So from here, I'm just going to take a big deep breath in and blow out. And then there she automatically cavitates because she's in a good position. So go ahead and make those 3 techniques or corrections to your techniques for the thoracic spine manipulation, and then let me know how they go.